guys, thank you for visiting my channel, Medical Assistant with Miss K. My name is Kendra, aka Miss K, and I'm a medical assistant instructor. So today I want to talk about patient intake and the importance of verifying allergies with each visit, as well as reconciling medications and even verifying, history. So especially social history. I'm going to get to social history later, but you guys know I've shared before on the channel that I used to work full time at a cardiology practice. Now I just work there, PRN. So I go in when they call. If I'm available, I'll go work. So I actually work there today. And that's why I want to make this video, because when I was working up a patient and I asked about her allergies, and I said, I'll just say Miss Smith, I just want to verify that you are allergic to, and I said the medication. She said, I'm not allergic to that. I said, really? I said, we have it listed here as an allergy. She said, no, I just don't like it. She said, I just didn't like it. I said, oh, we have it listed that, you get headaches from it and something else was there. She said, no, I just didn't like it. And so what I did was, because I use EHR, I hit delete. And if you use EHR, specifically Epic is the EHR that we were using. So I hit delete and then it gives you a reason. So I chose the reason, which was error. And then there was a little note. So I just typed in, patient says that she's never been allergic to this medication. She just didn't like it. And I put it in quotation marks. Anytime you quote the patient and you're typing exactly what the patient said, you want to just put it in quotation marks. And so this is prime example why it is so important to verify medications and allergies and things like that each time. And I know that it's easy to get comfortable when you have established patients, especially when you have patients that you see on a regular. I know, like in cardiology, we have patients that come regularly, every few months or every month, and then you kind of get comfortable and, you see the medications and you may be thinking, I verified them or reconciled them on the last visit. And I ask the patient, hey, is everything still the same? A lot of times they'll say yes, but not realizing that they didn't update us, or for whatever reason, you want to always just go through each medication, right? And I know it can be time consuming, but anything can change from day to day. First of all, the allergy was entered in error, okay? And then as she was seeing other providers, for some reason somebody wasn't verifying her allergies with her, because if they would have, they would have noticed, okay, when they asked her, hey, I just want to verify you're allergic to this, she would have said no, like she told me. And so you just want to verify. And also medications can change from visit to visit. Another example, I had a patient today. He had just saw his primary care physician early in the day, and when I was going over his medications with him, he said, oh, let me give you this one. So he gave me, showed me the prescription. He said, my doctor just ordered this for me today. So that's a new medication. And again, these are regular patients that come in, but his medication list changed from the last time he was in, like a month prior to today. And so I just want to remind you guys that also social history. So smoking, you want to ask the patient, are they a smoker? Do they drink alcohol? Even if you already have it in their chart that they are or they aren't, you want to just verify, because if they're a smoker, they could have quit since the last time they were in, right? Or if they weren't a smoker or they didn't drink alcohol, they could have started since the last time. So you want to always verify everything, right? I know you guys know to do all of this with a new patient, but we tend to get comfortable, like I said, with those established patients, okay? And another thing that I want to add is that when you're asking about social history, specifically, whether they drink alcohol or whether they smoke, you want to always ask in a way that you're not making them think that you don't approve of what they're doing, right? You never want to say, you don't drink, do you? Or you don't smoke, do you? Because then they may not be comfortable with letting you know, or they may feel bad about themselves, right? Even if you feel like those things are not right, it is outside of our scope to, unless the provider specifically gives you instructions to educate this patient on, they need to stop smoking or they need to stop, drinking alcohol. That's outside of your duties as a medical assistant. Again, unless the provider specifically tells you, or unless your office is like that. Like, for an example, organization I worked at years ago, they wanted us to ask a patient, and it was a part of meaningful use. And once we asked the patient if they were a smoker, how many cigarettes they smoke a day, for how long, we did have to ask them, have you ever thought about quitting? Okay, and then we had to put yes or no. But even in that, it wasn't our duty to educate the patient on the importance of quitting. Okay, we would just put yes, they thought about it, or no, they haven't. Okay, so hopefully this video helped you guys. For anybody that wanted some more information about patient intake. I do have a video already on patient intake, but I was coming from the perspective of a new patient. And again, I think you guys know to go over all of that information with a new patient, but don't forget anything that I said here. Verify every single time, even the demographic information, on the administrative side. If you're working front desk, maybe some of you guys may be watching this and you do both. Make sure you're verifying the phone number and address because the phone number could have changed since the last appointment, okay? So, guys, until next time. Oh, before I go, make sure you guys check out my website. So, you guys know I have these stethoscope necklaces that you can add your name to. Make sure if you do go to my site and order it, you put in the notes section on the shopping cart page the name that you want on. I've got a few orders that they didn't put a name, and I had to reach out via email to get the name, but it is in the notes section of the shopping cart page. Okay. Again, thank you for visiting my channel. Be blessed.